Hello everyone! We are the researchers from Centro Escolar University Malolos, Department of Dentistry from the Philippines. We are here today to present our research entitled Level of Oral Health Awareness, Attitude, and Practices on the Oral Status of the Barangay Healthcare Workers in Balagtas, Bulacan. Authors, Ms. Andrea Liwag, Ms. Luzraine Galvez, Ms. Lian Lopez, Ms. Bianca Lozano, Ms. Marcelino, and our research advisor, Dr. Shirley S. Wong.
Oral health is a key indicator of overall health, well-being, and quality of life. According to the World Health Organization, healthcare workers play a central and critical role in improving access and quality healthcare for the population. They provide essential services that promote health, prevent diseases, and deliver healthcare services to individuals, families, and communities based on the primary healthcare approach. This study aims to identify the level of awareness and commitment of barangay healthcare workers when it comes to oral health. Serving as a primary implementer of healthcare from a community level, it is critically important to assess their consciousness, address the existing gaps in knowledge and information sharing, and to advocate for an inclusive and informed society when it comes to protecting our oral health. As no such study has been conducted in this region, the study was conducted to assess the level of oral health awareness, attitude, and practices on the oral status of the barangay healthcare workers in Balagtas, Bulacan.
Theoretical framework. This study is anchored from the hierarchical model named Bloom's taxonomy that consists of 3 domains: the cognitive, affective, and psychomotor, whereas the researchers used the model to be the base of the study. This research used the model to support the study in determining how the level of awareness, attitudes, and practices is associated with the oral health status of barangay healthcare workers in their contribution to every individual member of the community. The conceptual framework of this study, as shown in figure, illustrate the independent, dependent, and moderating variables used in the study. Figure shows the paradigm of the study with awareness, attitude, practices, and oral health being variables, illustrating the study's objective to know the level of awareness, their attitude, and practices related to the oral status of the barangay healthcare workers. The awareness variables are the knowledge with regards to the proper oral hygiene and practices of barangay healthcare workers, while attitude are the effective measures on how they react, feel, or approach the community. The practices variables are the behavior of barangay healthcare workers in keeping their mouth clean and disease-free, while the oral status is the state of an individual's oral condition. The researchers incorporated the moderating variables, which includes educational background, age, and gender that can also influence both the independent and dependent variables.
For the methods, a correlational study design was used to collect data from the barangay healthcare workers in Balagtas, Bulacan through the management of a questionnaire and an oral examination of the participants. The questionnaire measured the participants' level of oral health awareness, attitude, and practices. According to World Health Organization 1987, DMFT index and oral hygiene index was used to measure the presence of dental caries, periodontal disease, and other oral health problems. DMFT index, meaning decayed, missing, filled teeth index, was determined using the procedures by the World Health Organization Basic Oral Health Survey method, which classifies the DMFT index into 4 categories as shown in the figure 1. Oral hygiene assessment was performed using the OHI-S, or the Simplified Oral Hygiene Index, by examining the calculus stains and debris on a particular tooth surfaces of 6 index teeth according to World Health Organization Oral Health Surveys, 5th edition 2013. The OHI-S is measured by adding the debris index, which is the DI, and calculus index, which is the CI, together, and is classified into 3 categories, which is shown in Figure 2, using the same procedures of a similar study of Purnama et al. 2021. For classification, 0.0 to 1.2, it is good. 1.3 to 3.0, it is moderate. And 3.1 to 6.0, it is bad.
For the results, majority of the respondents were female with highest number of college graduates. All of the respondents answered that they use toothbrush and toothpaste in cleaning their teeth. More than half of them are aware of brushing their teeth twice a day and believe that toothbrush must be replaced after 3 months, and a person should visit a dentist twice a year. In terms of their oral hygiene attitude and practices, it has been revealed that majority of the barangay healthcare workers visited a dentist only when they experienced pain and for extraction of their teeth, and last visited a dentist more than a year ago. And the reason behind not visiting a dentist was due to lack of time. Regarding their oral health status, using the DMFT index by counting the number of decayed, missing, and filled teeth of the respondents, among the barangay, Barangay Pulonggubat had highest average of DMFT index at 25.8. The data suggests that there is a high level of dental caries experienced among the healthcare workers with variation across different barangays in Balagtas, Bulacan.
In terms of the distribution of the respondents among the Simplified Oral Hygiene Index classification, the results suggest that the level of oral hygiene was moderately bad among the respondents, with a few exceptions in certain barangays. Regarding their oral health status using the Simplified Oral Hygiene Index, Longos had the highest OHI-S score at 6.62, while Santol had the lowest OHI-S score at 0.83. For the conclusion, based on the results of the study, it is concluded that barangay healthcare workers in Balagtas, Bulacan have adequate awareness towards oral health. However, the oral health status of the healthcare workers of Balagtas, Bulacan is poor with high DMFT index and bad oral hygiene index. And also, there is a gap between the awareness and the practices of the healthcare workers in the promotion and maintenance of their oral health. An introduction of training programs to all the barangay healthcare workers is recommended to further enhance their awareness and practices towards oral health. Lastly, we would like to acknowledge and appreciate the efforts of Centro Escolar University IERB in reviewing and giving ethical approval in conducting such a crucial study, and to our program head and research advisor, Dr. Shirley S. Wong, for sharing her knowledge and guidance to us. Moreover, we would like to thank the barangay health centers and all the healthcare workers in Balagtas, Bulacan for their cooperation during the time of survey and examinations. And of course, we would like to thank the organizing committee of the 9th International Multidisciplinary Conference. Thank you and God bless.